Thank you for the introduction, and good day, everyone. My name is Zhang from Kirby Institute at University of New South Wales in Australia and Nanjing Medical University in China. And today, as an early career researcher, I'm really delightful to able to represent our group and provide this presentation on implementation social innovative pay it forward approach. So today I will use these 15 minutes to talk about the social innovation in healthcare delivery, sharing our experience of implementing a social innovative idea, pay it forward in China. So until 2021, there are still 4.5 billion people still lack of coverage for essential health service, and there are various challenges in improving the health service delivery, including the limited access to service and persistent healthcare inequities, huge out-of-pocket health spending, as well as the distrust in medical care. And in the last decade, we have seen that social innovation has emerged as a really powerful tool to address the complex social challenge. And in this presentation, we define the social innovation in health as inclusive solution to address healthcare delivery gap that meets the needs of end users through a multi-stakeholder, community-engaged process. In this definition, it contains 4 key elements. And the first, social innovation is a participatory process to improve the social inclusion. And second, it's looking for the new ideas to address the social problems. And also, it wants to meet the people's need through the increasing level of the participation and the empowerment. At last, it also seems like a label for the social change. And brilliant, innovative ideas often generated by the community themselves who are familiar with the context and gaps. So it is really important to have community-led social innovation that can improve health delivery and make a real difference. But even the most brilliant idea can only survive and rotate if we can prove that it works, which has real challenge for a lot of innovators. And in 2014, the WHO TDR, in collaboration with several partners, helped to establish the Social Innovation in Health Initiative, CHI, to advance the social innovation through research, advocacy, and capacity building in low and middle income countries. In 2021, CHI has published a monitoring and evaluation framework, which aims to help the innovator to better understand the various factors that make their social innovation work and effective and help to make this process better. So today I'm going to use CHI's framework to go through the process of developing and implementing pay it forward concept in healthcare service delivery. So what is pay it forward? I just wonder, could you raise your hand if you have ever heard this concept before? Oh, thank you. It seems like about half of the participants already familiar with this, and we actually can see a lot of good examples in the daily life about pay it forward. We have seen the pay it forward chain in the coffee shop when the people pay for the next person's coffee. And we also can see it in the mentorship. So when a mentee who has been guided by a mentor grows and feels supported, they often pay it forward by mentoring the others, creating a continuous chain of support and growth. So here we define the pay it forward as someone receive a gift or service and then ask if they want to give the gift to another person. Through the theory, the pay it forward is a form of the pro-social behavior that encourages people to do good things for others. This concept often explored through the upstream reciprocity reciprocity, where the recipient of the kindness are more likely to pass it on. And on the right, you can see the road of the social reciprocity in pink. The idea is that when people receive help from others and feel graduate, it creates a recipient glow and motivates them to share, be more generous to others. And the warm glow refers to the positive emotions when they are giving. Pro-social behavior also seen in the mutual aid, so we have seen a lot of these good examples in the HIV prevention context. For example, the peer support HIV prevention program, where the community felt connected by receiving the service from their peers and generate a social responsibility to help each other. So after familiar with idea, we want to see if we can use Pay It Forward to improve the health service delivery. And the first test we do is on the gonorrhea and chlamydia testing. So gonorrhea and chlamydia are very common sexually transmitted infections among Chinese gay men. Also, like many other countries, the testing in China is not subsidized, and the test is usually cost about $22 in a hospital. So the testing rate among Chinese MSM are quite low. And we conducted a two-arm quasi-experiment study in Guangzhou to pilot test if the Pay It Forward could improve the uptake of gonorrhea and chlamydia among gay men. So in this experiment, we have two arms. The first arm is Pay It Forward arm. We invited gay men to visit a community HIV testing site and also give them the chlamydia and gonorrhea testing. The individual are told that the testing fee is about $22 but they will get a free test a day because previous testing who cared them already pay for their test. And after the testing, they will ask whether they want to donate to others who come to the clinic in the future. And in the standard of care arm, women offered a test at standard price. And in this study, we recruit about 446 men, and the study output showed that only 6% of men in the control group tested for gonorrhea and chlamydia, while about 54% of men in the Pay It Forward did the test. Another interesting point is, although the participants in the Pay It Forward arm could pay nothing, but about 89% of men choose to donate it. So the initial result of this pilot study shows that, like other traditional public health intervention, Pay It Forward can increase test uptake and potentially reduce some financial barriers for some of the men. And during the implementation team added another personal touch. So the participants could write a postcard encouraging others to get tested. When a new participants come to the clinic, they can see this message from other peers and the potential to boost the community engagement and ownership of the STD service. The postcard also become a key social incentive in the Pay It Forward service delivery package in the later. So following this quick pilot study, we want to evaluate the effectiveness of Pay It Forward approach in a more robust approach. So we did a cluster randomized control trial, and this study was conducted in Guangzhou and Beijing. In this study, the men were randomly assigned to in cluster to three groups. The first is Pay It Forward group, which I already described before, and the second group is Pay What You Want. So where men were offered a free test and could pay at any desired amount they want. The design of this arm is to capture the free reduction component of the Pay It Forward. And the third group is the standard of care arm. So let's see the result of this RCT. So we recruited about 301 men, and you can see it's a very young group. About over 70% are less than 30 years old, and about 20% from relatively low-income countries. 9% never tested for chlamydia and gonorrhea before. And on the bar chart below, we can see the output of this RCT. So in the standard of care arm, about 18% of men tested, and in the middle, it's the pay what you want arm, about 46% of men tested. And on the right, it's pay it forward arm, and it got the highest testing uptake. So about 56% of men tested in this arm. Also, in the pay it forward, about 94% participants choose to pay it forward after receiving a free gift test from the previous tester. And the average amount of the donation was about 53 RMB among those who tested and donated. Although it is not enough to cover the whole program, but it's significant proportion and seems really encouraging. So it seems like the pay it forward works to improve the testing rate, but to make sure the innovation can make a change, more needs to be done to ensure that there benefits the population at a larger scale. So we started to test the potential of this social innovation idea to address other challenges in health service delivery in China, such as low uptake rate of hepatitis B and C testing among gay men, and also other population, influenza vaccination among children and older adults, and also HPV vaccination among adolescent girls. Before the intervention, we worked closely with the local communities to make sure the pay-it-forward intervention fits their value and also is feasible and appropriate for the local context. So we have employed different strategies to tailor this pay-it-forward intervention. For example, the hepatitis testing used the community-engaged approach. We tailored the wording to introduce the pay-it-forward to the participants, and also to increase the acceptability of the intervention. The HPV vaccine intervention conducted in-depth interview and a discrete choice experiment to assess the parents' preference on HPV vaccination service delivery for their daughter. And the flu vaccination pay-it-forward project was conducted during the COVID pandemic. So we used the digital tools to simplify the program procedure and to increase the program's feasibility. Also, in the hepatitis testing program, we empower the community to design and lead the intervention by themselves through the training and workshop to increase the ownership of the program. So I will just quickly summarize the outcome of the pay-it-forward. First, from the client perspective, the in-depth interviews conducted among the pay-it-forward participants, and the participants show that they like it because it could offer them a flexible pricing health service. It also kind of improved their confidence about vaccine safety, importance, and effectiveness. Participants also reported it helped to strengthen the community connection. One participant said that they feel warmer and less lonely in the pay-it-forward intervention. Also, this channel actually makes them feel that they are heard and cared for. Pay-it-forward also improved the community engagement. So one participant said it generated a great level of interaction and engagement and a strong sense of community connection. From the service and implementation perspective, pay-it-forward was effectively improved the uptake of health service across different programs, and it is also a low-cost way to expand health service. So, for example, the cost effectiveness analysis shows that it's cheaper than the standard of care, and considering both economic and financial cost. The total donation also helped to offset some of the cost for the screening. Pay It Forward also reached and connected marginalized population. In the Pay It Forward model, we can see that it's particularly useful in promoting among gay men who use drugs. At last, the Pay It Forward is improving the community solidarity in different ways. So to conclude this presentation, I would like to talk about some ongoing work and unanswered questions to moving forward. And first, we want to see whether the Pay It Forward could generalize to other settings. And also, currently, Pay It Forward is only evaluated in the research context. The question remains still whether it could in the real world setting, how it works. And what is the best ways to implementing Pay It Forward? And I just found one of our colleagues did a poster about the factor that influencing Pay It Forward success. And please check it out during the coffee break. At last, we want to test the boundary of the Pay It Forward and if there are any ethical considerations related to the implementation. So I would like to acknowledge all of the community organizations and all of the participants in our project, the SET team, UNC Project China, and our diligent group member, especially for our study PI, Professor Zhou Tucker and Wei Mingtang, and all support we received from all of the institutions. Thank you.